The sickout at public healthcare facilities continued on Friday, severely constraining operations at the Princess Margaret Hospital on New Providence and the Rand Memorial Hospital on Grand Bahama. The Nassau Guardian understands that more than 300 healthcare workers called in sick today, which is double the number of workers that were absent on Thursday. Bahamas Public Services Union President Kimsley Ferguson said healthcare workers are irate over the seemingly arbitrary distribution of the promised honorariums put aside for frontline and non-frontline workers during the COVID-19 pandemic.
There is a concern in relation to this COVID-19 honorarium. Persons would have forwarded me a document that is a response from the Ministry of Health in relation to who received the COVID-19 honorarium. I think one of the things that would have stood out in the document was the fact that the minister's personal assistant and chauffeur would have received a COVID-19 honorarium.
In a statement yesterday, the Ministry of Health said while Minister of Health Renwood Wells did not receive any of the funds allocated for the honorariums, it confirmed that his driver and personal assistant received honorariums. Ferguson said this was insulting.
It is indeed a slap in the face to the healthcare professionals that persons who are outside of the immediate response area receiving an honorarium. Again, I do need clarity on what the criteria is for persons to receive that.
Ferguson said the union is still trying to understand what the criteria is for honorariums, as he claimed that there were healthcare workers who were at greater risk than the minister's personal assistant and driver. On Tuesday, Wells said that honorariums were paid to healthcare workers who worked during the first wave of the COVID-19 pandemic.
Again, let me draw reference to the fact that the personal assistants and the chauffeur received. Which part of the front line were they on? That's the question I have.
In a statement, the Public Hospitals Authority said the sickout impacted Princess Margaret Hospital's laboratory, radiology, and diagnostic services. The morgue, which is already suffering from overcrowding of uncollected bodies, suspended services until further notice. At the Rand Memorial Hospital, laboratory and phlebotomy services were severely impacted, and blood donation services were suspended.
I cannot slight them for taking whatever action they're taking because these persons want to be properly compensated.
Ferguson said staff in the laundry department, housekeeping, laboratory, and radiology services are among those who should have been given consideration for payment. Reporting for the Guardian News Network, I'm Berthany McDermott.